Okay, here we go. Excuse me. Here we go with the, I believe it's the eighth week of our psychopathology course, and this week we will be talking about autism. So I know you have the readings. I know you've read through there about the biochemistry and the genetics and all the different theories about um, where autism comes as far as a neurodevelopmental condition. Um, Let me just talk some about that in a more diagnostic sense. The readings, of course, cover for you um, the development of it in a neurological slash biological slash chemical type um, view. So let's talk about the other aspects of autism as a diagnostic category. Autism is, and I just used the term here a second ago, neurodevelopmental. Autism is a neurodevelopmental disorder. What that means is that it is considered to be caused by a neurological condition. And specifically, neurodevelopmental means that it is expected that um, that is a condition that is present throughout the individual's life. In other words, it does not develop later on in um, life. It does not develop as the result of some neurological change or a brain injury. You can have conditions that look very similar to autism that can be caused by a number of different diseases, head injuries, emotional trauma, uh, but that is not the same as autism. Uh, Now, what is interesting about autism is that the theory behind or the thinking behind where autism comes from is that it is present as a neurological condition from birth on. In other words, part of the understanding of autism when it comes to diagnosing someone with autism is that there has to be evidence that the individual was showing the presence of this neurological condition even prior to birth, or certainly at birth. Um, Now, you certainly could ask the question, it's a legitimate question, well, how do you know? Now, there are neurological tests that can be done prior to or just after birth, but most of them aren't done, um, especially since there are considered to be some pretty solid genetic markers for autism that can show up prior to or just after birth. The question um, is it legitimate to test for those things? It's not like autism is a life-threatening illness, and it's not like somebody who has autism won't be able to survive or has something contagious. So most of the time, the neurological tests that can be done to see if there is evidence of autism, either prior to or just after birth, aren't done because there's no real point to it. It's sort of like the same argument of um, some of the genetic markers that can be used to determine if a child might have Down syndrome. A lot of times the argument is, well, is that such a good thing to do? Because if a parent knows that their child has autism, then they may decide to not go through with the pregnancy. And is that fair to the child, given that Down syndrome is not life threatening? Down syndrome is not contagious. So the degree to which that argument is made with Down syndrome is made even stronger with autism. Uh, because even if there are genetic markers that can pinpoint if someone has autism, there really is no reason to most of the time to even worry about. I mean, not to worry about, but to have that information, it's not going to help anything. Is sort of the thinking behind. But I digress. So there are these genetic tests that can be done for seeing if there's evidence right before or right after a child is born that they might have autism. Now, for the most part, if you are evaluating a child with autism, you would not have that information. So really, it comes down to the standard is there at least has to be solid evidence that the conditions for autism might have been present right before, right after birth, or at least there's no evidence that they were not present right after or right before birth. So there has to be uh, clear evidence to support a strong likelihood that this individual has had um, autism all of their life. Now, as I talk about this, you may be aware, and I actually forget if it's mentioned in the chapter for this week. The certainly very strong, very public debate that's been going on with regards to vaccines and autism, um, and whether some vaccines might um, cause autism. And certainly the scientific research does not support that. Even the study that came out that was sort of used um, as the as sort of the standard by which that argument stopped. There was debunked. What basically happened is when all the arguments, and this is just more for historical perspective, when all the arguments from some people started saying that autism may develop in some children as a result of vaccines, it came about from a study that had been published in a rather prominent medical journal. And then it turned out later on that the authors of that study um, uh, basically stated that they had not been honest with their results. So they debunked the study themselves. They themselves said, this is not a legitimate study. We don't stand by these results anymore. So there you go. I mean, they pretty much pulled back on the research themselves. So, um, given that, you then have this argument that continues that some vaccines may cause autism in young children, um, and where a lot of the argument has tended to focus has been on certain chemicals that are in the vaccines, uh, mercury being one, and also the argument that sometimes vaccines are given much too young. That's the argument um, that is made by people who are against vaccines and who support more strongly this whole idea that some vaccines may lead to autism. Those are the two main points they try to really stress there. But there is no real solid evidence that vaccines cause autism. Now, having said that, and I certainly don't mean to speak against vaccines, but it is an interesting point to consider that in some cases, it may be that the difficulty is focused more on semantics than anything else. What I mean is this, and this is not what I'm doing right now is not to go into the anti-vaccine argument at all. That's been pretty solidly debunked scientific wise, at least as far as do vaccines cause autism. However, it is worth keeping in mind that what I mean by semantics is a lot of times the argument is only focused on do vaccines cause autism in any case. No solid scientific evidence for that. However, there are other neurological conditions that look like autism. You can get a neurological condition that is similar to autism from a number of other uh, neurological um, conditions. Some genetic uh, depletion conditions can lead to symptoms of autism. This is where individuals are missing certain genes in their genetic code. You can get symptoms of autism uh, from uh, certain types of chemical disorders. Certain things happen to the individual's biochemistry in young children. Swallowing certain poisons or certain chemicals can lead to a very dangerous conditions that can end up with the individual looking like they have many of the symptoms of autism. Certain types of brain damage can lead to conditions of autism or conditions that look similar to autism. Head injuries can look, the impact of certain head injuries can look like um, autism, but they are not autism, but they can look like autism. Um, they're under DSM 4, there used to be a condition called phenomenological disorder. And that was basically, it was under, in fact, it was under the categories of, and I'm sorry, no, not phenomenal, it's phenomenal, PHONOLOGICAL, phonological disorder. Uh, that actually was under the same category as autism. It's not there anymore. But that disorder was one where the individual seemed to be developing normally. And then at about 2 years of age, stops and actually regresses. That that is a condition where the individual looked like they were on a normal progression as far as development goes, and then all of a sudden they have a setback for some reason and they're no longer progressing. That is another condition that can look very similar to autism but is not considered autism. So you have here a number of conditions that can look very similar to autism, but are not considered to be the same thing as autism. And under the different diagnostic categories, it would be called things like psychological disorder due to a medical condition or psychological disorder not otherwise specified. So, in that case, you have a condition very similar to autism that develops for other reasons. And so the issue then becomes one of um, uh, the, con- the situation then becomes one where you have to ask, okay, so um, and by the way, so you have to ask, what does that mean as far as the different ways that the term autism is used. And by the way, when I say it looks like autism, I want a minute get to um, what that means as far as what the symptomology is of autism. But the bottom line of this is that um, the bottom line of all this is you are dealing with a condition called autism that looks a very specific way, but looks in a way that other conditions can seem similar to. So, where was I going with this as far as the vaccine argument goes? Well, in very rare circumstances, and this isn't even controversial, but in very rare circumstances, uh, individuals do have medical reactions to getting vaccines. This has been known for a long time. Uh, in fact, when you sign the form, when a parent gets a child vaccinated, they sign something that says there always is this danger that something could occur. That nobody says that vaccines are 100% in every case totally safe and there's never any problems. Um, um, they never say. You can see that even, and I'm not trying to talk anybody out of it, but you can even see that with the COVID vaccine. There's been no secret that many people are getting very sick from it. Now, the argument is, of course, it's legitimate. The argument is, well, there are a number of people who, yes, do have symptoms that they describe as a very bad flu-like symptom for a day or two, but it's a trade-off because it's better to get that than to get COVID. That's the argument. I only bring that up because there's never been an indication, an argument with any vaccine that there isn't some danger and that there aren't people who end up getting sick and sometimes very sick from it. It's just that the risk to benefit is considered to be the thing, and that the benefit for the vast majority of people are considered to be better than to not get the vaccine just because of this very small possibility that someone may develop something from it. And one of the outcomes of people who have had bad reactions to vaccines has been neurological. So it is interesting to consider if this argument about whether someone who gets a vaccine, a very young child who gets a vaccine, could develop autism. It's interesting if the weight of that may simply be the fact there's even an argument there, if the weight of it may be because people are insisting on using the word autism. If you changed it and said, is it possible that someone, because I don't know if there's any evidence that anybody from a vaccine has developed autism. Like I said, autism is considered to be something that's there all your life. So, um, how then someone could develop it if they get a vaccine at 6 months, how that could be considered autism is an argument. But if you changed it and said, so if you made the argument, has there been anyone who has ever developed autism because of a vaccine? You could get a lot of professionals who simply would say no, but that has more to do with the definition of autism. If you change the question to, has any child ever developed a neurological condition that looks like autism, that has some of the same symptoms, but is not exactly autism? Um, I would I think there'd be a lot more room to say yes, that has happened. May not be autism, but it may be a condition very similar to autism. I took a little bit more time than I expected with that discussion, but there were two reasons for it. One is simply that anymore, you can't talk about autism without addressing this issue of the vaccines. I had mentioned last class that I've done presentations across the country. Um, you know, several right in my home state of Pennsylvania, and some as far west as um, uh, Wisconsin, and as south as Florida and Louisiana. So I've been in a lot of different places where I've talked about autism. And this question always comes up. Somebody's always asking about this. Um, so it was sort of the elephant in the room. I wanted to address it because if you're understanding autism, you should have something to say about this argument or about this topic. But the other is because I think it says something about autism and how autism is this one neurological condition that is considered to be there throughout birth, but there are other conditions that may be very similar to autism that may respond also to the same therapeutic interventions as the one that work with autism. Okay, so having said that, let me talk about what autism is. Autism is a neurodevelopmental condition, meaning it's been there throughout the individual's life, and it has at its very base a cause that is in the way the person's brain works, the brain makeup. There's something different about it than other individuals. And in order for autism to be diagnosed, there has to be three types of symptoms met: social comprehension problems, communication problems, repetitive behaviors. And I will talk about all three. Social comprehension problems means the person interprets social interactions in a way different from most other people. Um, there are many times that I've heard that this specific symptom um, gets mislabeled as social skills problem, and that's not exactly true, or not exactly accurate. Social skills problem is certainly how it comes out. The individual looks like they can't, don't quite grasp all the appropriate behaviors for interacting with other people. So social skills problems are certainly present, but they tend to occur more from social comprehension, a misunderstanding of social interactions. That is essentially one of the symptoms of autism, is that the individual has social comprehension deficits. They have deficits in terms of how they understand social interactions and how they understand and perceive um, social norms. They may intellectually know social norms, um, but do not put them into place. And it's not an intellectual problem. It's not that they cannot comprehend the intellectual aspects of social rules. They just do not fully understand them to the point where they can use them in a way that is as effective as people who don't have autism, or they at least come off, um, they at least result in the same behaviors as people who don't have autism. Okay. Um, I, in order to sort of explain this issue of social comprehension, I want to tell you just a small story I've used uh, as sort of a descriptor of how this works. Uh, in one of the earlier versions of the IQ test, the Wechsler Adult Intelligence Scale, there was a social comprehension subtests. The IQ test is made up of different subtests, and one of them was called the social comprehension subtest. And it basically was um, uh, a series of social scenarios where the individual being tested had to give responses to what would be the appropriate way to handle certain these social scenarios. The first question on the test was, what would be the thing to do if you were walking down the street and saw an envelope that was sealed, stamped, and had an address on it? Sealed, stamped, and had an address on it. And of course, the answer to the question is put it in a mailbox. I remember once asking a professor about this. It was a professor who was teaching our IQ testing course. And I, I, I said, um, well, it seems like I've known people who could answer that question, yet probably wouldn't actually put um, put the letter in the mailbox. And the professor agreed with me, and he said that you could imagine a scenario with an individual with autism if you, for whatever reason, pictured that the individual with autism was given an IQ test while walking down the street with the examiner. Not that that would ever happen, but if you imagine a scenario where the individual with autism was being tested by this individual and they were walking down the street together, and the evaluator was giving the test while they were walking down the street, you could imagine a scenario where the individual with autism would be answering the question, what would be a thing to do if you're walking down the street and saw an envelope that was sealed, stamped, had an address on it? You could imagine a scenario where the individual with autism was given the correct answer to that question while walking past an envelope that was sitting on the ground that was sealed, stamped, and an address on it. The distinction the professor was made, and I thought was an excellent point, was the question on the IQ test was, do you intellectually know what the answer to that question should be? Do you know what the right answer should be? And even individuals with autism know intellectually what that answer should be. They may even be able to recite to you what social rules and social norms are. If you gave them a test of social norms where you just asked them about social norms, they may very well get a very high score. What they don't consistently do, and this is where the issue of walking past the envelope that was sealed, stamped, and address on it comes in. What they don't consistently do is put those social norms into practice. They may know what the correct answer should be, but they do not necessarily put that into practice in their daily life. You can think of it in a lot of different scenarios where people without autism do the same thing. The one that pops out at me is most everybody I know who has a driver's license knows that the correct answer to the question, should you ever go above the speed limit, is no. But many of them do anyway. They know what the right answer would be. They know that you should not go above 55 miles an hour. And yet, the vast majority of people who have driver's licenses at one point or another do go over that speed. They know what the answer should be, they just don't always put it into practice. Uh, Same sort of scenario with this issue of the difference between social comprehension and social skills. You may know what the right answer should be, or no, the difference between social comprehension and intellectual functioning. You may know what the answer should be, but you don't consistently put it into effect. And that's one of the major issues associated with autism. So, by the way, what that also references, and I will touch base on this either later this lecture or at the live lecture, is there is no direct connection between autism and intellectual functioning. Individuals with autism, individuals with autism run the gamut of intellectual ability. There are some people with autism who have very low intellectual functioning and some who have very high levels of intellectual functioning. I've worked with a number of individuals with autism, many of whom were in some sort of learning support program or life skills program for lower intellectual functioning, yet several of them also were in the gifted program at their school. So autism runs the gamut as far as intellectual functioning. Social comprehension is one area of symptoms for autism. Communication skills is another. The ability to express oneself. Individuals with autism tend to be very limited in terms of their communication skills, specifically with regards to things like the pragmatic use of speech, getting across their point, using words. They may even know, again, the difference between intellectual functioning and autistic symptoms. They may know words, they may know what the words mean, they just may not consistently use them in effective ways to get across how they're feeling and what they're thinking and what their wants and needs are. So so there's social comprehension, communication skills. One other thing about communication skills, by the way, is um, there used to be, when there wasn't just one. Right now in DSM-5, there's only one category of autism spectrum disorder. Um, there used to be three in DSM-4. There were three of them. I'll talk about those here later. There used to be three of them. Now there is one. When there were three of them, there was this um, diagnosis called Asperger's disorder, which was considered to be high functioning. Say it was sometimes called high functioning autism. There still is this category of high functioning autism that, although it's more of an informal term now, it's not formally defined. Uh, but it is used in the research. And for the most part, when it comes to the question of what, where do individuals with high functioning autism function the highest? In other words, where is the difference usually seen between what the individuals with high functioning autism can do that individuals with lower functioning autism cannot do as well? And the answer to that question is usually communication skills. Individuals with high functioning autism are typically seen as individuals who can get across their points, get across their wants and needs, get across their feelings verbally in ways that individuals with lower functioning autism cannot. So it's the area of communication skills that tend to be the higher functioning area for individuals who are considered to have higher functioning autism. Okay, so we have that as well. Okay, so like I said, communication skills are the area where individuals with higher functioning autism tend to function higher. That tends to be the higher part of the higher functioning autism category. So far we have two of the three. There are three primary symptoms that are associated with autism that have to be there for a diagnosis of autism: social comprehension, communication skills, and the third category is what is called repetitive behaviors. repetitive behaviors tend to fall into two different categories, and the individual could have one, the other, or both. Um, One is called stereotypical behaviors, also called self stimulatory behaviors. Some of those behaviors, the most common example of a self stimulatory behavior is arm flapping. Many times, individuals with autism uh, have frequent periods of time where they will just flap their arms. Um, some other categories of these types of self stimulatory behaviors include uh, different types of sounds, no, not words. We'll talk about that in a second, but different types of sounds, clicking noises, possibly snapping their fingers or clapping. But these tend to be repetitive behaviors uh, that occur for no clear reason. So those are self stimulatory or stereotypical behaviors. The second category of repetitive behaviors that occur in autism are what is called perseveration, meaning basically the person focusing on the same topic over and over again, uh, and not being able to be redirected away from that topic. Now, perseveration may be sort of repeating facts or repeating specific information about a certain topic over and over again. But perseveration could also be literally repeating the same statements over and over again. There is one specific type of perseveration that I've seen a lot in kids with autism, and that is called scripting, where the individual will repeat phrases from their favorite um, movie or TV show. And it doesn't even have to be their favorite, just one they happen to be familiar with. Um, so you may, for instance, have individuals, um, children who will repeat lines from a certain Star Wars movie. Star Wars seems to be a very common movie where the scripting often comes from. So they will repeat lines over and over again from a Star Wars movie. So that is called scripting. It is where the individual picks up a line from a favorite movie or favorite TV show and then just continues to repeat that over and over again. Not even in reference to a specific type of situation. So it's not like they use quotes from a movie to give advice for different types of situations. When the individual with autism repeats these phrases over and over again, it is to the degree that what they are saying has no direct relevance to what is going on or to what the other person is saying. It's just repeating things over and over again. And that is called scripting. So there you have the three sets of criteria for autism. And for a diagnosis of autism, all three have to be there. It used to be under DSM 4, it used to be that there was a diagnosis for situations where an individual had two, but not all three symptoms. There may have even been a case, there definitely were cases where the individual might only have one symptom of autism, uh, but that symptom was very severe and prevalent. That diagnosis was called pervasive developmental disorder not otherwise specified, sometimes shortened as PDDNOS. PDDNOS. And that was a diagnosis that was considered to be a type of autism, but did not involve all three symptoms. That diagnosis is not in DSM 5 in any uh, in any manner. That diagnosis that diagnosis was taken out. As I said earlier, another diagnosis that was taken out was called Asperger's. And Asperger's disorder was sort of seen as um, the diagnosis for high functioning autism. And as I said before, the high functioning autism uh, was typically somebody whose communication skills, although still impaired, was not as severe as individuals with lower functioning autism. It was that area of communication that tended to be the area that was most intact, or that was more intact for individuals with Asperger's disorder than other uh, versions of autism. Uh, so at one point under DSM 4, you had Asperger's disorder, autism spectrum disorder, and PDD NOS. There were three categories. You now have, and there were a few others. I already spoke about phonological disorder. You now have one, autism spectrum disorder. Before moving off the issue of diagnostics, I would like to talk about two other diagnoses that are relevant to this discussion. One is a disorder called social communication disorder. Um, as I said before, there were three categories of symptoms, three criteria that need to be met in order for someone to have a diagnosis under DSM 5 of autism spectrum disorder. Social communication problems, I'm sorry, social comprehension problems, communication problems, repetitive behaviors. When an individual was diagnosed previously with PDD NOS, the most common situation was when they had the social comprehension problems and the communication problems, but not the repetitive behaviors. Under DSM 5, you can no longer have a diagnosis of autism without all three symptoms. So you can't have that diagnosis. Um, however, um, if an individual has social comprehension problems and communication problems, there is a diagnosis called social communication disorder that can be used. Now, what's noteworthy about social communication disorder is it is not a form of autism. It is separate from autism, but it is considered to be a diagnosis whose criteria are social comprehension problems and communication problems. So, social communication disorder, but does not require the third category of repetitive behaviors. So, that's the diagnosis that came about as a way of addressing situations where you had someone um, with social comprehension problems, the difficulty understanding social interactions, um, communication problems, difficulties getting across their wants and needs using words or nonverbal gestures, but didn't have the repetitive behavior. Social comprehension disorder. Um, there is the other diagnostic category that I want to talk about is called reactive attachment disorder. Reactive attachment disorder. And this is a disorder that looks very similar to autism, has many of the same features as autism, but um, is not considered to be a neurological disorder. It is considered to be a disorder that comes about for psychological and emotional reasons as opposed to neurological reasons. Most often, the events that trigger reactive attachment disorder, the events that relate to this psychological response that you have these symptoms, um, is some sort of abuse. I have worked several times with individuals who have been diagnosed with reactive attachment disorder. The situation that pops out at me as far as where I have seen this most clearly have been in individuals, in children who were adopted um, from an orphanage in a third world country. And so there wasn't a whole lot known about what happened to them in the orphanage or how they wound up in the orphanage. But what was known wasn't very good. So there clearly were a lot of very bad things that happened to them. And there just wasn't a whole lot of good information about that. Reactive attachment disorder tends to come about from some sort of severe trauma, including abuse, that occurs before the child is 3 years old. Trauma and abuse occurring before the age of 3 is considered to be extremely debilitating because the child does not even have a voice to put into words what is happening to them. I'm not talking about, reporting it to anybody, that not even a voice to tell themselves about what's going on. So a child who is abused or suffers intense trauma before they develop any sort of adequate degree of skills to communicate tends to develop this very, very intense feeling that the world is an unsafe place and that bad things are waiting to happen and around every corner. And that leads to a very intense impact in terms of how the child develops emotionally um, and socially. So that is reactive attachment disorder. It has many of the symptoms similar to autism, but it has as its core a psychological cause, usually related to some sort of trauma or abuse, as opposed to a neurological cause. Okay, so those are the different versions of um, the those are all the diagnostic issues related to autism, and also some information about other diagnoses that are similar to or have different aspects associated with autism spectrum disorder. Okay, so autism spectrum disorder tends to be a lifelong disorder. It develops because of neurological factors and um, often requires behavioral treatment. There is no medication for autism. There are medications that can address some of the more severe behavior problems that can be associated with autism. There are some, for instance, antipsychotic medications that are used for individuals with autism who have very severe aggressive and agitated behaviors. So, but that would be an example of a medication being used to treat a severe symptom of autism and not to address autism altogether. Um, Autism has been around since the 1930s. It previously was thought to be a form of childhood schizophrenia. And as time went on, and there was an understanding that these individuals were not disconnected from reality, like is the case often with schizophrenia, but just were not comprehending the world in the same way as other individuals. As that became understood, there was less of a focus on it being something like schizophrenia and more of an understanding that it seemed to be a difference in terms of how the person processed the world. And it's interesting to note that that's often how autism is described these days, which is that it is a condition where the individual processes input from the outside world differently from how other people might interpret and process that same material. Sometimes, very often, individuals with autism will describe themselves as being part of the neurotypical movement. And the neurotypical movement is a movement primarily among individuals who have autism that essentially says that autism is not a disorder, it's just a difference. That people with autism process the social world differently than others, and that that doesn't make them wrong or make them have a disorder or make them mentally ill in any way. It just makes them different. And individuals who are part of the neurotypical movement will describe individuals who do not have autism as neurotypical, meaning your neurological development is typical. Mine is not. That doesn't make it bad, it just makes me different. So, an emphasis there on differences as opposed to something necessarily being a problem. When you work with individuals, what you often will do is uh, use some sort of behavioral interventions that are used to help the person learn better skills for navigating their social world. The difference when I've worked with individuals in therapy uh, to help them learn skills for comprehending social situations better and communicating more effectively when they're interacting with other people. What tends to be the difference is I am teaching to these individuals with autism approaches that may come naturally to other people. So things like interpreting whether the person is being sarcastic or not, or interpreting whether what they said meant they were angry at you. Those are skills that can be taught. And once an individual with autism is taught those skills, they can use them. So even though someone without autism, the process for deciding whether someone is being mean to them or whatever may come about more naturally with the when it comes to the individual with autism, they can learn the skills to help them make those same decisions and navigate more on their own the social world around them. So helping them develop those skills is often one of the main goals of therapy when it comes to trying to help someone with autism. Okay, this is a good place to stop. Why don't we pick this up when we meet on Thursday?